lift up a bit and tuck underneath. You want to see what's happening first. Okay, head slightly tilted, but that's kind of normal. What's not, which is normal but shouldn't be happening, is our shoulders are moving in. Even when you just try to relax them, they pop right back up. So when I go to work on the pecs, this is going to be something I'm going to focus on. Now the shoulders aren't coming up that high, which is good. They're just rotating in, which means she rotates forward too much. So when I work on the pec, I'm trying to get it back down. We're going to start with the head and neck. So I'm going to put her into a neutral position and gently rock the shoulders down. That's my way of telling them, relax. Take a long deep breath. And this is just something I like to do. I'm doing a dry effleurage, but I'm pulling the head up, which is giving a little traction to the neck. With some motion. Effleurage coming all the way up to the base of the neck. And to keep my hand on the client without breaking, I'm just gonna hold one hand there and do it one at a time. This is the basic effleurage. From here, is where I'm gonna turn. Always take note of how far your client's head is going. When we finish, her head's gonna go farther. But for now, we know what we're working with. Effleurage, out to the shoulder, back up to the head. One more time, out to the shoulder. What you guys don't see is that my thumb is engaging right around here. I'm pulling in the back of the traps into a muscle called supraspinatus. And I'm just pressing down slightly. And I'm coming back up. And this is where my thumb relaxes. Now I can put my thumb back into work by doing a motion we call stripping, which when you come along the muscle and go across its fibers.
What was the word again?
Stripping.
Stripping.
I'm just pressing here. Now, even though I'm working on the neck, most of the neck muscles go straight into the shoulder. So I'm going to go underneath that scapula. And this is where my petrissage of the neck is happening. It's happening to the back and the neck at the same time. Just a scooping motion. Don't be afraid to move your client around a little bit. It's perfectly normal. Just doing a little stretch. Now with barely any pressure, you see the difference in the head? Mm-hmm. So it's been stretched a little bit. That's the part of having the fascia relaxed. Once that gets relaxed and is not stiff, you get a little bit more mobility in the head. To finish that up, you kind of want to flush out everything, push it back down, gently come back. Make sure you direct the client's head. Same thing on the other side. Up behind the ear, around the shoulder, and back. Your pressure here can be light to medium. Engage the mid portion of the traps. I'm lifting her with my fingers and then pulling with the thumb. this right here is going deeper. I'm just holding my fingers in place and pressing the shoulder into the hands. Did you feel that?
Mm-hmm.
It's allowing her fibers to relax into my hands and then gently break up. So you can do deeper work without doing deeper pressure. You just have to know where to work things. Back up. I'm gonna ease up because her body jerked a little bit when I was doing the cross fiber. Just gonna go a little lighter. I'm just doing a gentle push on the head. Coming back up. Come back in for final effleurage. You can include scalp in the neck. But I saw you brushing your hair earlier, so I'm not gonna mess up the wave. Yeah.
And she said, "Don't go against the grain."
Yeah, boom. I bet. So, moving down. I'm gonna pull the sheet down flat, right? And I'm gonna go underneath and pull at the wrist. Bring it out, flatten it, hand over top. Even though I'm not working on the arm right now, that's what I'm gonna do to get to the pec. You don't have much space to work with here. So I'm just gonna take the edges of my hands and I'm pushing out towards the deltoid. You can do two hands at one time, one behind, one on top. Just pull in the same direction. Pull down just a little bit. Come in with the forearm. And there's two angles you want to go. Down, so across, and then out towards the shoulder. Now even though I'm going over bone, I'm going extremely light without adding any pressure. Coming underneath, getting behind the scapula. From here, because you already have the arm out, you can transition straight into the arm. Same concept as the leg. Up, around the shoulder, into the hands. To work the inside of the arm, just bring it out, and you're going to do one hand at a time. Here. You can use one to stabilize, the other one to work. You could also change the position and use your forearm.
That's what you're working on doing, but the back. That's what I was doing.
Now where you don't want to use your forearm is on the forearm. It's not much space. So simple effleurage, petrissage of the forearm, same as the leg. Just back and forth, picking the muscle off of the bone.
What if your client have a little extra meat like myself? I'm in the forearm. Can you do?
If there's the more space, the more of your body you can use.
Okay.
So if there's not much space here, then my forearm is bigger than her forearm.
Right.
But if my forearm is not bigger than your forearm, I can use my forearm. Down into the hands, which a lot of people skip, and you should. Reason why is even if you don't have a job where you're typing on a computer or you're doing any heavy lifting, everybody has a phone and nobody puts their phone down. So what happens is everybody's hands start to conform like this. A way to open the hands up is starting at the forearms. The forearms are your flexors and your extensors of the fingers. So you want to go in, if a good way of showing if a client's hand is tight, hers opens up naturally. If I open your hand, right, and it does this, I have to strip your forearm open to allow your hand to open up. If your hand opens up naturally, I don't have to do too much work in the forearm. Now I can just strip the fingers. So her hand opens up naturally, which is good. I'm going to start at the wrist. Going in and out. Sorry, excuse me. Like a windshield wiper, but opposite direction. Has anyone ever drove a Honda Civic? Okay, well, Honda Civics, I hate this about them, but they have stupid windshields. So instead of going this way with the wipers, they go out. So you want to wipe like a Honda Civic. The wrong way. Just in and out. When it comes down to the fingers, flip the arm back down. Go in between the bones and slightly twist.
Is it light pressure on the palm?
You can go a little medium. The finger's light pressure.
Okay. The bones.
Because of the bones. There's barely any tissue here. You're just going in a circular motion, opening up everything. You can do some compression to the hand. And go back up. Finish with an effleurage. Now to get the arm back in, same concept. Just going to pull tightly towards the skin, slide underneath. Perfect. Into the leg. You want to do some compression on the side of the hip because just like the glute, you don't want to skip it. So you're going to come alongside the bone, take the palm of your finger, palm of your hand, press in on the side of the hip. You can come in, go down with the fist. Compress. When I'm doing compressions, I'm looking for the areas of tension. It's closer up by the hip. So I'm going to diaper drape. You want to go around the knee. Not hop over it like this, but just go around it. And then up towards the hip. Back down. Take the feet. Now the reason why I always drape and the diaper drape face up is because I need to get to the inner thigh. The leg is going to be incomplete. That's going to take a little readjusting, but still not showing anything. So you want to pop the leg out like this. Come down. Effleurage very quickly with the lotion so that it's applied and then go back in. Forearm. Change your stance. I'm stabilizing the knee with my right hand, massaging with the left. Working them at the same time. Now, we had a situation earlier. If anybody has larger breasts, instead of leaning in, come off to the side, arm, you're gonna do it this way. Pull the leg back down. You have this huge bone, tibialis. It's in the way. You want to get to the muscles alongside of it. So after you effleurage up, you're going to turn your hands this way and compress, going on the sides of the bone.
If you were to go upwards on those muscles, is that okay too?
Yeah, so I'm going to go
Okay.
in both positions.
But it's always up, never down on the leg, right?
Yes. Me going down like this is just a compression. I'm not dragging down. I'm just going in that direction.
Yeah, no, I meant like when you go up, you never go down.
Yeah, so I wouldn't go up and then
Okay.
start.
Yeah, okay.
Because all of your blood needs to flow towards the heart. When I'm compressing in a downward manner, I'm just spreading the tissue off the side of the bone. You can petrissage, going up like this, or do your standard side to side as if you would normally do. Doesn't matter. Now you're not going to fully skip the knee. I don't really want you messing with the patella right now. You can go along the side, do the same thing. Compression. We stand all day, it's going to need some sort of relief. But I don't want you working on top of the bone. Right above, below, on the side. Feet. To stop it from being ticklish, you want to use firm pressure. You're gripping the foot now and pulling. You can come in with the thumbs, strip side to side.
For feet, would you have to go in a certain direction too, or it doesn't matter?
The feet doesn't matter. The feet kind of like the hands. You're just watching out for bone. The trigger point on her foot. I'm gonna get out really quick. Pretend I'm in a stool. And I'm just using my fingers in this motion, going up the tissue. You're going to learn later in reflexology that your foot, you're broken up into zones. 5 zones. 1, 2, 3, 4, 5. The zone goes down your foot in a straight line. So a good way to work the foot is to work it in the zones. Compression here, zone 1, move over. Zone 2, zone 3. Follow that down. You don't need to know the exact muscles right now. You just need to know where you're working. So pretend I did all of that. Come back. Make sure I get in the ankle and the heel. But be honest, working the heel is easier prone, but working the arch of the foot is easier face up. So you want to marry both of those while you're working on the leg, especially if they have like a hip issue, because their feet is probably the ones that's throwing them off.
Mm-hmm.
And it was an effleurage.